Okay, I think we'll make a start. You can see the numbers are starting to go up a little bit, but we'll make a start. So welcome, everybody. I'm Darren Morgan. I'm the Engagement Director at the Economic Statistics Centre of Excellence, ESCO. And welcome to the latest in the research webinar series that we run in spring and the autumn. I just want to say thank you for joining us. I know people lead busy lives these days, so the fact you've chosen to spend an hour with us, we are very grateful for you doing so. And I think you've chosen well. I think we have a great topic today, measurement of intangible assets in the healthcare and public sectors, continuing to be a very important topic, if anything, growing in importance. So it's great that we have two experts with us to discuss it with us today. It's Chris Warmington from the University of York, and also Mary O'Mahony from King's College London and ESCO. So those of you who haven't been to a webinar before, our webinars before, the structure we have is that Chris will talk for around 40 minutes. Mary will talk around 10, and then we have around 10 minutes for questions at the end. And on that, you'll notice, those of you who live on Teams, you may notice at the top of your screen, there's a Q&A pane. You have the normal chat function, but you should see a Q&A pane as well, chat function. That is where we take the questions, the Q&A pane. So if you do have any questions, please pop them in there, and we can hopefully have a good discussion after Chris and Mary has spoken and discussed the topic. So I know you haven't come to talk to you about from me. You want to hear from Chris and Mary. So Chris, let's make a start, and over to you.
Thank you. So yeah, the topic of our seminar today is the measurement of intangible assets in the healthcare and public sectors. We perform a scoping review of current knowledge and extend it to an application of the NHS app. So first of all, an overview of the session. We'll start by defining intangible assets. We'll move on to why they're important, and then why they're important specifically for the public sector. And then we'll move on to the aim of the study, the methods we use and the results we get, before extending an application to the NHS app through a worked example. So to start with, what is an intangible asset? Well, they're usually defined following the Corrado, Holtons and Sichel, henceforth CHS framework, as non-physical durable stores of value. That is to say, they're any form of non-physical capital, examples including data, software, branding and organizational techniques. They depreciate similarly to tangible assets, but in a slightly different way. So whereas tangible assets depreciate through physical wear and tear, these kind of assets depreciate through economic obsolescence. So you might imagine a piece of R&D might become out of date as new and better information becomes available. Some assets, such as software and R&D, are already recognised in the system of national accounts as capital, whereas others, like branding and organisational techniques, aren't, and they're still treated as intermediate consumption or day-to-day spending. So they're particularly important to understand as they're highly synergetic and scalable, and they're typically less rivalrous and appropriable than tangible assets and lead to knowledge spillovers. So in other words, they're key to productivity growth. They often enhance other assets or labour, and they are typically able to be used by small or large numbers of people with little increase in costs. They're particularly important in modern service-based digitalised economies, which increasingly involve the use of intangible assets. For example, in the UK private sector, intangible asset is equal to investment in more traditional tangible assets over the past few years. And just on a conceptual point, they are valid as capital under the definition of capital, which is a store of value which lasts for more than 1 year or period. And therefore, they're just as important to understand as normal, more intuitive assets for the economy. So in the public sector in particular, UK healthcare productivity has been flat over recent years. Improving is crucial under the resource constraints we face, particularly considering the demographic challenges in the future. And public service productivity is measured as a ratio of outputs to inputs. Therefore, accurately measuring intangible capital, which can function as both inputs and outputs, is essential for understanding this productivity. And just a little note on the inputs and outputs point. Depending on which asset it is, they could function as either. So the example I use is the NHS app, which is an example we'll be coming back to repeatedly. It's an input in the sense that it frees up time for NHS admin staff to reallocate their labour to other productive activities by saving them time on the functions the app performs. But it's also an output in the sense that it provides a benefit to patients through convenience and improving the quality of service potentially. The recent NHS 10-year plan heavily emphasises the use of intangibles. It speaks about an analog to digital transition, increasing the use of AI, and a key feature is the federated data platform, all of which obviously involve digital intangible assets heavily. But despite all this importance, there are no regular estimates of intangible assets in the healthcare or public sectors in the UK, unlike the private sector. So there are some estimates of it. For example, in the Smart Public Intangibles Project, or SPINTAN, there's estimates of organisational capital levels in the English NHS, and there's an EU CLEMS measure, which is released yearly and measures the level of intangible assets in various EU countries, but it doesn't disaggregate it into asset types. There's no regular estimate in the same way that the ONS publishes estimates of intangible assets, both in the national accounts and the non-national accounts intangibles every year. So we conduct a scoping review following PRISMA standards to answer 3 research questions. Number 1, what methods are used to measure intangible assets in the healthcare and public sectors? Number 2, what specific challenges are posed to the measurement of intangible assets by the public sector setting? And 3, what would the effect of including intangible assets in a measure of public service productivity be? And in light of our findings, we also propose an alternative valuation method using a worked example of the NHS app. So as I said, this review follows PRISMA guidelines for scoping reviews, and we searched 3 databases. One, PubMed, is sort of more health focused, and the other 2 are more economics focused to try and achieve some kind of balance. 2 reviewers independently complete each stage of the review. I'll go into a bit more detail of the stages on the next slide, but here are the inclusion criteria. So it must be free to access in English. The publication must concern at least one intangible asset and its measurement. It should be focused on the healthcare or public sector at large, excluding certain things like publicly owned corporations or government-sponsored enterprises. And we set the earliest date the paper can be as 2005, in the hope that it's influenced at least by the CHS framework. So here is our PRISMA diagram explaining the stage of the review. I'm aware it might be a bit small on some of your screens, but our search returned 651 results after duplicates were removed. And then after an abstract screening completed by both reviewers independently, we take 61 forward for full text review. And of these, 31 were judged to meet the inclusion criteria and were included in the full study. A key and unexpected division that we saw was between the intellectual capital literature, which generally derived from management and business literature, and intangible assets or intangible capital literature, which came from a more economics and accounting side of the literature and generally came from the CHS framework. So more on this division. Intellectual capital contains only part of the spectrum of intangible assets, namely human capital, structural capital, and relational capital. However, the boundaries of these assets are very inconsistent. And what I mean by this is what was included specifically in each of these human, structural, and relational capital varied massively by study. In particular, structural capital sometimes included IT-related assets and sometimes didn't, which is obviously quite a significant part of any intangible asset spectrum. They also tended to use indicator or survey methods, resulting in ordinal valuations, and the studies were quite challenging to repeat. So you can imagine it's quite logistically difficult and costly to repeat a survey every year. Intangible capital, meanwhile, was more focused. It was more consistently defined as it followed the CHS framework, resulted in cardinal measures, and the studies were easier to repeat as they typically used pre-existing accounting data. So here's a slide taken from Evans et al. Defining intellectual capital in healthcare organisations. But as I said, this is just one sort of taxonomy. There's no standard definition. I'll just give you a little minute to read that, and I can always put it on at the end if anyone wants to come back to it. And then this next table shows the different categories of intangible assets within the CHS framework. So just to clarify, on the left is the market sector. The original CHS framework from 2005 was designed for the market sector, and it has these categories you can see on the left. In 2016, the Smart Public Intangibles Project, or SPINTAN, it sort of extended this framework to the public sector, which you can see on the right. Broadly, they're pretty similar. You can see most of the categories remain the same or very similar. There's slight differences in terms of there's two categories rather than three, and some assets exist in the public sector but not the private sector. For example, cultural and heritage assets and schooling produce human capital. And again, if you want to see the table at the end, just let me know. So it comes to results now. We'll first start with research question 1 to remind you what methods are used to measure intangible assets in the healthcare or public sectors, and we identify 3 methods as we've hinted at. Survey-based methods used in 39% of the studies we identified, indicator-based methods used in 35%, and CHS or national account style methods used in 42%. And just to clarify why those percentages don't add to 100 is because some studies used a mix of survey and indicator-based methods. So survey-based methods are sort of what they sound like. Respondents are asked questions to indicate the level and importance of intangible assets at their organisation, and the results are collated into some kind of index. The methods were very inconsistent. There was no standard set of questions which were used to assess any given asset, and the method of indexation also varied from study to study. They also give ordinal results that are in non-common units, which makes it very hard to compare between studies, between assets, and just makes it challenging. It's also questionable to what extent respondents can accurately assess intangible assets. They're very difficult to conceptualize, and so it might not even be consistent within the same study.
So Peter Mandelson misled him about the nature of his relationship with Jeffrey Epstein.
Hi, I think someone's, oh, sorry, that's okay. Someone's just come off mute. I'm not sure who it is, just to be aware. Just check your mute settings. Thanks. Sorry, Chris, back to you.
No problem. Yeah, we'll move on to indicator-based methods. These methods use sort of proxy data points to indicate the level of a given asset at a firm or organization. Examples include training, expenditure per employee, or size of data holdings per firm. So an advantage these obviously have over survey methods is they're somewhat more objective. The training expenditure per employee is a fixed number, but obviously they struggle to capture quality as well as quantity. For example, 2 data sets might be the same size, but they might be very different in terms of how useful they are and therefore how valuable they are. Some of the indicator methods attempted to include ways of capturing quality, but when they did this, they typically reduced the objectivity, which I just said gave them an advantage, as they typically did so by including more of a survey-based element. They, again, like survey-based methods, aren't standardized and give results in non-common units, again, making comparability between studies, between assets, and over time very difficult. The third method was CHS type methods or national account style methods. These value assets at their market purchase price when they're purchased externally. So, for example, if you buy a piece of software from an external developer, its value is taken as what you paid for it. Or if they're produced in-house, they're valued using the sum of cost method, which is the net present value of past investment in an asset. And there's an equation summarizing the sum of cost method. Just let you look at that for a minute before I move on. So the advantage of these methods, are they're consistent, as they generally derive from the same sort of framework, the CHS framework, and they give results in monetary units, which means comparisons are much easier. They're valid over time between assets and between studies, and they can also be used in national accounts. However, whilst the market purchase price is appropriate where a fair market exists, this isn't necessarily always the case in public sector purchases. And also, the sum of cost method uses adjustment factors, for example, for time use and capitalization. And as there's not very good evidence for these in the public sector, they're usually taken from private sector estimates. To clarify, what I mean by this is if we were examining a company, assessing the organizational capital levels within it, we might take a group of managers and estimate the amount of time they spend on forming organizational capital or organizational techniques. So you might judge they spend 50% of their working time on that. So it would take 50% of their wages as a cost towards that asset. We might also imagine that not all of this effort results in durable capital as opposed to intermediate consumption. So we might say another 60% factor capitalization rate to assess the value of the asset and the costs that go towards it. But because there's not very good estimates of the time use or capitalization rates within the public sector, these factors are usually taken from the CHS framework in the private sector, which may or may not be appropriate for the public sector. Additionally, the sum of costs method relies on certain neoclassical assumptions that don't particularly work in the public sector. For example, constant returns to scale, a flexible capital supply, and a lack of monopoly power. In other words, the logic of the sum of costs method is that companies wouldn't spend more on an asset than they expect to benefit from it. But that's quite hard to observe in the public sector, even for the organisation itself, as their outputs and goals are sort of non-monetary. But it's hard to judge the point at which you stop spending on an asset. So as an example of the flaws of the sum of costs methods, I've again come back to the NHS app. So we'll imagine a hypothetical scenario where there's two apps, A and B. They were both developed in similar ways with similar functionality and to do the same things, namely book appointments, manage prescriptions, enable patients to view their healthcare records, all the things the NHS app does. But for some exogenous reason, app A serves twice as many patients as app B. The sum of costs method would value them similarly. They have similar development costs, and for an app, the difference in serving 100,000 versus 200,000 people in terms of costs is relatively small. But it's pretty obvious they have different values, both in terms of benefits to patients, so you serve twice as many people, and the convenience benefit to using the app, twice as much benefit, or in terms of to the system itself, if it frees up time for admin staff to reallocate to other activities. If it's freeing up more time, it has more value, quite simply. Put another way, the NHS app doesn't meet the necessary conditions for the sum of costs method. It doesn't operate in a competitive environment, and I would argue it displays increasing returns to scale, so it makes it inappropriate. Coming to the second research question, what are the specific challenges in measuring intangible assets posed by the public sector setting? So the intellectual capital shares a broad consensus that the area is under research compared to the private sector, and notes that politicization, knowledge intensiveness, and a high degree of intangibility shown in the public sector make the measurement challenging. But how this actually affects the measurement on a sort of a practical way is very underexplored. The CHS literature shows relatively minor differences between the methods for measurement in the public and private sector. Even the CHS in the private sector uses the same market price and sum of cost methods. As we saw earlier in the table, there are some slight differences in terms of categorization and asset types. It's pretty minor, and many assets that may not appear to translate well from the private sector to the public sector, like branding, on closer examination, do present quite well. The literature was pretty quiet on this question, and I think it was very underexplored. And finally, to the last research question, we say, what would be the effect of including intangible assets in a measure of public sector productivity? And what I mean by this is, what would be the effect of capitalizing assets that aren't currently capitalized in the national accounts, like branding or organizational capital, on such measures? Well, unlike the private sector, there's very little focus on productivity. A key focus on the private sector in the private sector literature is what effects it would have on productivity. But as both labour and total factor productivity statistics don't fully account for the role of the public sector. For example, in labour productivity, the public sector is generally taken as an inputs equals outputs convention, and total factor productivity doesn't really consider it at all. There would be no effect, so the literature doesn't pay much attention to it. The main reason for this is, as there's no output prices for the public sector, as they're not sold on the market, there's no way to assess the rate of return to capital. The Spintan project in 2016 suggests imputing a return to capital to overcome this, and I think they suggest the social rate of time preference. But the evidence for this is not clear, or why this is the best, or if we even should do this, so I don't see it happening anytime soon. There was no consideration of the effect of capitalization on Atkinson-style public service productivity measures, as are published by the ONS, or the Centre for Health Economics. And I think this is mainly due to the challenges associated with measuring inputs and outputs in the public sector. So to conclude our review, this scoping review summarised the current state of measurement of intangible assets in the public sector. We identified three methods which all have their own flaws. We found that the measurement of the public sector is not massively different to measurement in the private sector, beyond some sort of superficial difference in categorization, but it's received less attention, partly due to the challenges of measuring public service productivity, and especially the outputs. So in light of our critique of, in particular, the sum of cost method, we provide an extension where we suggest an alternative method, the income method. This method values assets as the expected net benefit or income the owner expects to get from the asset over the course of its service life, and it, like the market price or sum of cost method, is in the system of national accounts. Like the sum of cost method, it gives answers in comparable monetary units, but doesn't require the same restrictive assumptions. And just to be clear, this is for assets that are produced in-house still. And it's typically seen as more challenging to implement, as especially in the private sector involves prediction of future income, which is obviously challenging and hard to get right. But we believe the public service productivity setting provides a unique opportunity to sort of advance this method, because it already deals in measuring and comparing complex non-monetary and monetary factors. Additionally, for certain assets like the NHS app, which is the example we use for this, public service productivity is typically published on a 2-year lag, whereas data for the app is available much sooner. So it makes it easier to forecast. We apply this to the NHS app to value it in the financial year 2022/23. So for this exercise, we conceptualize the app as a labour-saving device. In other words, it allows NHS admin staff to save time they would have otherwise had to spend completing the same tasks that the app completes, so booking appointments, viewing healthcare records, managing organ donation status, and the like. And this allows this labour to either be saved or reallocated to other productive tasks. So for the purpose of this exercise, we treat the app as an input to the healthcare system, because it was done with Atkinson-style productivity methods in mind. So any output-based effect, which, as we mentioned earlier, would be sort of in terms of convenience or ease of booking for the patient, is considered as an output of the system as a whole, so separate to the app, and it would be expressed through the quality adjustment and the patient experience survey. So, as I mentioned, the income method is the net present value of the expected benefit or income from the app, and this equation summarizes how we calculate that. So you can see it's the sum over the service life, which is 3 years, taken as 3 years from the Spintan project for software. So we have function f completed by occupation O in time t of function type A multiplied by the time taken to complete that function, that task by a given occupation for the given function, and the wage, the deflated wage of the occupation in time t, subject to a discount rate, which was taken as the social rate of time preference according to the Spintan project. So we provide 2 separate estimates for this based on 2 different data sets. Firstly is the NHS app activity data set. This covers the whole time period, but only for 2 functions of the app, namely booking appointments and ordering prescriptions. And we also use and this provides in terms of number of appointments booked, less cancelled, and number of prescriptions ordered. And the NHS app benefit data, which covers all the functions of the app, but for only some of the period. And this gives data in terms of the hours saved by the app for NHS staff. So obviously we have to forecast the missing data using growth rates taken from the app activity data, and also we don't have an insight into how this hours saved was calculated, so it makes it a little bit harder to take as accurate. The wage data was taken from the annual survey of hours and earnings, excuse me. But as we couldn't access detailed 4-digit level SOC and SIT code data, they were pretty high level wage estimates taken for pretty broad occupation categories, and they also include private sector workers in their estimates. Additionally, time estimates, by which I mean the time it takes to complete a given function, are not they're sort of stand-in values. They were created through conversations with several GP practices, but shouldn't be taken as accurate at all. So we also produce a sum of cost valuation for comparison purposes using data from various NHS development contracts. And again, here's the equation summarizing the sum of cost method that we saw earlier. We use a depreciation rate for this and the income method of 1/3, which is taken from the private sector CHS framework. Unfortunately, we couldn't use the perhaps more appropriate public sector SPINTAN depreciation rate of 0.315, as that would have involved use of data from the 25-26 financial year, which we didn't have for either data set. We also use the generic GDP deflator. And one clarifying point, so the app is owned by NHS England, which makes it not sort of a candidate for the market purchase price method, but its development is contracted out to various software developers from where we got the costs. So move on to our results. We can see the income method valuations are much, much higher than the sum of cost methods, up to 287%, depending on the method we use, suggesting the sum of cost method may be a lower bound. But given all the caveats I've just given about like the inaccuracy of the time methods, the wage data, and sort of the lack of theoretical justification for how I've conceptualized and implemented the method, we should take these very cautiously. Such a large increase, especially if it was applied to many different kinds of assets or many types of assets, would have significant implications for productivity and GDP calculations. So this shouldn't be treated as accurate. It should be treated cautiously. And I'm not proposing this as a fully accurate valuation. It's more to explore the use of the income method as opposed to the sum of cost method. So given all those caveats I've just given, what's the point of this exercise? Well, theoretically, the sum of cost methods and income methods should give the same results, as should market price methods, according to the system of national accounts assumptions. But as they give such different results, it suggests one, or perhaps more likely both, are inappropriate. And whilst the income method, as I've said, is not fully accurate and it's probably hardest to implement for many assets, I deliberately chose the NHS app as it's slightly easier to implement for it and the data was somewhat available. It's clear for this type of asset in the public sector, the sum of cost assumptions are not appropriate. So we need to start exploring other ways of measuring. So in terms of future work, I hope to see work that addresses the sum of cost method and whether it's appropriate for assets of this type in the public sector. And also to hopefully explore the potential use of the income method as an alternative going forward. I also hope for better estimates for the sum of cost adjustment factors in the public sector, which would improve the accuracy, and for the disaggregation of the intangible assets in public service productivity methods. So what I mean by this is in the private sector, growth accounting is typically performed to assign shares of growth to labour and capital. I hope to see that in the public sector productivity statistics and hopefully a further disaggregation into tangible and intangible capital too. Also hope to explore the effects of capitalising non-national accounts intangible assets on these Atkinson-style public service productivity methods. I'd like to thank you for listening. Here are my references and obviously happy to take any questions as they come.
Thank you very much, Chris. Super interesting stuff, really well explained. And just before I hand over to Mary for her thoughts, just a little reminder to put your questions, like Chris said, in the Q&A pane if you have any, and my thanks to Berkeley who have kicked us off with the first question. But Mary, over to you for your thoughts.
Okay, so Chris, could you stop sharing so I can see if I can share my slides? I mean, I don't necessarily have to, but let's see if it works.
Is that gone? Has that worked?
That's gone.
Cool.
Let me just, can you see that?
Yeah, it's not on full screen, but I can see it.
It's not in full screen now. Just am I going to do this? Okay, is that full screen?
It's perfect. Thanks, Mary. That's good.
Okay, great. Right. Okay, so thank you, Chris, for a very interesting presentation. And I just have to minimize this. Yeah. A useful scoping study setting out the differences in this intellectual capital and the CHS methods. And of course, I agree on the importance of including intangibles for public sector productivity measures. I think it's a really important thing that we need to do. So I I know it's your paper is a starting point, but it's quite interesting. Some of the results of the scoping study, there doesn't seem to be anything much done since the Spintan project. So I was very much involved in the Spintan project, and in terms of the CHS type methods in particular, there doesn't seem to have been much debate about how useful the CHS methods are in the public sector. In terms of the intellectual capital scoping papers you looked at, I did something similar for the Spintan project because we were very concerned about whether organisational capital in the public sector was actually very different from the market sector, and I read many papers and reached similar conclusions that the intellectual capital literature was very fragmented. There were some snippets of good insights, but it turned out not to be very useful. And I think the issue here, the real problem here, is that it has a different purpose. It's in the management literature. It's it has it's just not trying to measure these things, and so what you can get out of that is probably quite limited. But it's a shame that nothing really emerged very much in the intervening decades in Spintan. One little minor point here, please, could you reference the EU CLEMS Intan Invest that is produced by Lewis, not the one produced by WIW, which is they didn't do anything different from the Corrada et al. Team, and it's good to have the right reference there. I'm having problems. Oh yes, okay. Can you see the second slide? Yeah.
Yes, we can. Yes,
okay,
we can.
Sorry, I had a problem scrolling there, but that's fine. Okay, so what I'd like to do is focus on two questions. One is intangibles in public versus the private sector, and the second one is your application to the NHS app. So first of all, intangibles in public versus private sector. And so the question we asked is, why might public intangibles be different? And we debated this at length in Spintan. So that was a project that was funded by the European Commission with the express purpose of producing these intangibles for the public sector, because the work by Corrada et al. Up to that point didn't have any public sector estimates in. And I guess the approach we took is that intangible capital is an input. And even though the non-market sector, or the public sector, is producing outputs that are not traded and do not command a price, that the inputs actually are likely to be purchased in competitive markets. And so, in general, we decided to keep most of the CHS assets the same as for the private sector. But we did discuss it quite a lot. The exceptions, as you mentioned, were the organisational capital and adding the cultural and school-produced assets as separate assets, which I think do not appear in the private sector. So, but I do think there is a point at which we need to revisit this debate, because even though we did talk about it a lot, we also had a time constraint. We had lots of projects to do. We had to produce these estimates for the public sector. And so I'm not sure we gave it the attention that it really does deserve. So, so one thing that, is to look at what's different. And here I'm looking particularly at the NHS, because the NHS has monopoly power, and we know that impacts intermediates such as drugs. So, is there some way it might actually affect investments? So I've got a couple of things here that I think might be worth looking at. I mean, so the procurement processes are very different in the public sector from the private sector. And so even though they're buying in competitive markets, there are constraints. They face different constraints, administrative and political constraints. And so something about the way the NHS sources, for example, its software, might be worth looking into. That is, it might lead to something different. And then investments in NHS brand. Well, the brand is the idea of the brand is to capture product reputation, And I was asked a question at a seminar one time, well, why should we put in advertising expenditure by the public sector? Isn't that just all politics? And I remember giving the example that, something like anti-smoking campaigns is actually not, it has a public benefit. And I was thinking maybe this idea of brand could be linked to public health campaigns. Now, this is just an idea that came to me when I was reading the paper. It might not make any sense, and maybe other people in the audience would disagree. Now, the other things you mentioned is the time and the capitalization factors might be different in the public sector. And I think really, and I do in the paper, although I don't think you mentioned it in the presentation, the public sector time use survey should provide some very good information on that. And it would be really useful to look at that and possibly compare it with the private sector time use surveys to see if you can get some kind of a handle on these time factors. The capitalization factors also, they may be different in the public sector. I'm not sure why they would be, but there may be something in there. And you mentioned that the depreciation might be very different. So I just wanted to flag this paper by my former PhD student, which is an ESCO discussion paper on measuring the depreciation of intangible assets. And he's using Google Trends. And I wonder, are there other similar kind of big data out there, web-based data that should give you some handle on looking specifically at depreciation rates for assets in the public sector? Again, this is a off the cuff remark. I don't know how you would do this, but it might be interesting. And then turning to the NHF app, you as you said in the presentation, you're questioning the use of the sum of costs method for the public sector, and I agree that there are issues. I'm not sure that they're specific just for the public sector. I think there are lots of problems with economies of scale and non-competitive markets also for the private sector, but maybe they are worse. So you've used this alternative income method to value the NHS app and compare with the sum of cost methods. And I think what you've done here, conceptualizing this as a labor saving device and calculating the value of the NHS app using the benefits from labor saving, I think is the right way to go. So, but I would expect, given in theory, that you would have the sum of costs and income method should give numbers in the same ballpark. Now, I think your sum of costs and income method is actually the first. That particular calculation does seem to give, I would say, numbers in the same ballpark. But given the margins of error in both of them, to me, there's not a huge difference. But that's not true for the second. Sorry, I have a mistake here. For the second measure that you looked at, where you have this very, very large number, and it's not clear what's included here. So there's not much detail in the paper. I guess it's because you probably yourself don't know what's included in either measure. But I think it may be that there are things in these measures that go too far away from a production side national accounts kind of measure, and so you have to be a bit careful of what you use. And then I would say that the other thing that and I'm not sure how that impacts on your calculations or the data that's gathered, but you say there are no alternatives to the NHS app, but I don't think this is correct, because before the NHS app came on stream, there were other providers, and they're still around. Something called, I used to use Patient Access. I moved to the NHS app because in addition to being able to order prescriptions and book GP appointments, the NHS app has this extra information on your health records. But the two things that you're looking at, they were available before in something like Patient Access. And so I think it's not necessarily a new good. There was an alternative, maybe not as good an alternative, but I do think that does impact on the way we conceptualize this. And then I'd just like to finish with this this suggestion. I think that there's a very interesting paper on measuring the value of data by the Kurada et al. Team. It's in an NBR volume that has been published very recently. And I do think an additional conceptualization of the NHS app might be as a data asset. Now, in particular, that paper does make the distinction between data storage, databases, and data intelligence. And valuing data intelligence, how data is used, is something that's very, very difficult, but very worthwhile. Again, from the paper, I got the impression that the NHS is not using the data gathered in the app to better, for example, to better forecast patient needs, etc. But it's only used as a store of data. But maybe they will in the future. And I think more generally, it might be the case that actually data is different in healthcare and the public sector, given that much of it is open source. And I do think that might be a good place to focus further work on public sector intangibles. If you're looking for something that really is different, an intangible asset that might be really different in the public and the private sector, this might be a good place to look. And I'll stop sharing.
Thank you very much, Mary. Some thought-provoking thoughts and ideas there. Chris, I don't know whether you want to pick up anything specifically on what Mary have said before we go to questions, or
Mary, could you share the slides again, if that's okay? Cool. Yeah. Can we start with this one? So yeah, the data point is a really good one, especially in like the 10-year plan. They are seeking to use more the data for more things than they previously had. Perhaps the reason I didn't spend more time focusing on this is I don't know if that would be part of the NHS app. I think that would be more part of the federated data platform which they're creating, and because it would involve any sort of application of the income method, I guess, involves sort of trying to conceptualize the research benefits of that data set. I thought that would be quite complicated, so I left that as like a separate asset. And then because I was valuing the software from the NHS app rather than data. Could we go back to the previous slide, please? So on the lack of alternatives, yeah, I think that's a good point, and definitely something I should have made clearer, because there is, like you said, there is alternatives in terms of booking appointments. I'm not sure that there's alternatives in terms of the other functions of the app. As far as I know, there isn't. So in terms of managing prescriptions and viewing health records, changing sort of organ donation status and the like, I think that's unique to the app, but it's something that's worth checking before I go any further. And yeah, on the point of the second income method estimate, it was massive. It was much bigger than I expected. I think in a large part it's due to so the data I used, the app benefit data, it gave the hours saved by the app to NHS staff, but it wasn't clear what method they'd use to calculate this. And to be quite honest, I think the numbers were quite big, a lot bigger than I was expecting. But yeah, that's sort of more of my responses.
Thank you very much, Chris, for that. Right, over to the questions. Like I said, we've got a few already. Please, if anybody do have any questions, please pop them in the Q&A pane. But as I said, Barclays kicked us off. Chris, they say, you said that human capital wouldn't be an asset in the CHS methods, but later models Barclays thinks start to include firm-specific training. Surely there's some overlap with human capital, a good point, unless I'm misunderstanding.
Yeah, so that's a good point. I'll just clarify. More traditional productivity or growth accounting would calculate firm-specific human capital, as in knowledge that cannot be used by the individual outside of that specific organization as an asset of the firm, in the sense that it belongs to them, it's not useful outside of that firm. However, more general human capital is normally considered an asset of the individual. So in traditional growth accounting, it's considered as an aspect of labour quality rather than a, capital asset of a given organisation.
Thank you very much, Chris. Mary, I'm just checking you don't, just checking as a courtesy, you don't have anything to add for that question?
No, I think Chris answered that very well.
Yeah, that's good. Yeah, I agree. Thanks. And Barclays followed up again in terms of how easy do you think it would be to scale the income method approach, for example, to the whole public sector rather than specific data sets? They see the difficulty of doing this for any valuation method that is not sum of cost is one of the reasons sum of cost is relied upon so often at the industrial sector level. And they go on to say that it's not controversial to say at the specific data set level, sum of costs definitely isn't the best approach. It's well known that cost is not the same thing as value. But
Yeah,
Chris, your thoughts?
Complete fair point. And I think obviously it is challenging, and that's the reason why income methods aren't used more. I would say that I think within a sort of a Atkinson style public service productivity method is slightly different, and it slightly gives us more opportunity to use the income method in the sense that the income or benefits in that sense are health benefits for a healthcare system, so health produced or health activities undertaken. So it's slightly easier to both conceptualize and implement than perhaps in the private sector where you're trying to predict monetary income and market forces. But yeah, I don't know, and I wouldn't expect that it's easy to scale up to the level of the whole healthcare system. I picked the NHS app because it was a sort of low-hanging fruit, slightly easier to illustrate what my points I was trying to make. And yeah, I think it's questionable how useful it is, given that you might not want to have two different methods used for similar in-house generated assets in one sort of productivity measure.
Oh, thanks, Chris. Mary, do you have any thoughts on the scaling up point?
Yes, I agree. It's very difficult, but everything is difficult in measurement. I do think they are, something like the brand idea. I mean, I don't know how you would do it, but there does seem to be something there that might be worth looking at. That it is a way of bringing in some of what is the reputation of the NHS and bringing it in as an asset. So I wouldn't discount it. I think I really liked what you did with the NHS app, and I think it's a great way forward. So everything is difficult, as you know.
Yeah. Thanks, Mary. And yeah, and I think it's right. You could test it, see how far you can go. I think it's a good challenge. Prabhat, nice to see you on the call, Prabhat. Ask the question on the cost method for the NHS app. To what extent can you include any adoption costs over the app development costs? Should they be included?
By adoption costs, I'm assuming you mean to staff within the NHS integrating into their. Yeah. I don't know how you would measure adoption costs. I'm not sure if you could. I guess the best answer I could give was be in a sort of public service productivity method. If there were costs in terms of making workers less efficient temporarily, that would be reflected in the overall productivity statistics. As far as I know, I don't know any way to include adoption costs, no.
Before I check in with Mary, Prabhat, did we interpret your did we interpret your question correctly? Just to make sure, and please come on the call, come off mute if we didn't.
No, that was exactly right, and yeah, I imagine it's really challenging. But yeah, it's just about the transition costs and this exactly what you said, Chris. Basically, yeah. Thanks.
Thanks, Prabhat. Mary, maybe any thoughts?
No, nothing much on that. I think it's just very difficult to do. But Prabhat's right. I mean, maybe you should include these costs, but where you get the data, I don't know.
Yeah, and David, I'll come to you first on this one, Mary, because David's mainly a comment saying that he agrees with you, Mary, on the branding point that you made and the fact that it's noted in future international guidance. This point.
Okay, that's interesting. Yeah.
Yeah. So you can see into the future, Mary.
Yeah, right.
So I think we got one other comment, I think, in the other pane by Martin. Thanks, Martin. And I think nice to see you on the call as well. Martin says, a comment on Mary's point about alternatives to the NHS app. I think these provide a reservation cost for the NHS app and thus set an upper limit to the relevant price.
Yes, and I agree with Martin on that. I mean, going back to these alternatives, Chris, you mentioned that there's not much alternative, but actually for the main functions of getting prescriptions and booking hospital appointments there are. You know, I quite regularly used one called Patient Access. I mentioned in the slide. I do think it's worth considering these
Sure.
alternatives in this analysis. Yeah.
Okay, I will do.
Good stuff. Okay, that was good stuff. Good engagement. Good questions. I'm just going to pause a sec, see if anybody's got any other questions. And if you don't want to type it in the pane, obviously you're more than welcome to join the call, come off mute and ask a question directly to save a little bit of time if that helps. But I'll just give it a minute or so just to see if anybody's got any questions.
Darren, I wasn't going to, but I'll come in quickly if that's okay. As head of intangibles at ONS, I probably should say something.
Thanks, David. Please do come on in.
We met with Chris last summer, actually, so it's great to see this work come through, and I look forward to reading the paper afterwards. Just to comment on this, really, just for everyone's awareness, we publish intangibles at the ONS, but we only do the market sector at the moment. So it's great to see this work looking at what intangibles mean for the non-market sector as well. We are doing some work internally to look at the non-market sector, but Chris has absolutely touched on a point that goes through all of what we're doing. We are using the assumptions on time factors and capitalization factors, for example, from the private sector in the work that we're doing at the moment. So definitely a challenge there for us to think about how the public sector should be treated differently before we go public with this, because we've got some estimates internally of what the whole economy looks like now, but given the points that have been raised here, I don't think we should be ready to take that out to market yet, given that at some point we have to bring data as an asset out for the whole economy as well. I think we need to think about whether we should be treating the public sector differently, and this has been a great spur for us to start thinking about that. So thank you to Chris for bringing this.
Thank you very much, David, as well. Thanks for sharing. We're in some of the work that you're doing behind the scenes at ONS as well. That's really how I imagine that's really helpful for this audience to hear. So thank you for doing that as well. I'll just double check, Chris. Maybe here we go. Martin, please come on in.
Sorry, I just wanted to comment on something Chris said early on, that public sector is mainly measured on an outputs equals inputs basis. Is that actually still true in the UK? I thought genuine output measures were used for the majority of outputs now, but I hope someone on from the ONS can clarify that.
Could I come in on that?
Of course.
So there are those kind of measures. Those are the Atkinson style public service productivity measures I was referring to. When I said that, I was referring specifically to labour and total factor productivity measures, which is sort of the more traditional measures of productivity. But you're absolutely right, the UK does produce. The ONS produces good productivity measures specific to public services, but they're not disaggregated into labour and capital. So in terms of how much effect capital in general, intangible capital has, it's quite difficult to see.
Thank you very much for the question, Martin. Thank you very much for the clarification of what you meant, Chris. And I'll just double check. We come into the last few minutes of the call. Chris, maybe you got any thoughts on what David said when he came in and talked a little bit about what ONS, where ONS are?
The only question I'd have is, obviously Mary mentioned the ongoing time use survey. Do you think that will provide good information to sort of address the time use factors, David?
That's a great point, Chris. It's on the development plan to have a look at the time use, because at the moment we would just read across our private sector factors to the public sector, but yet we are in contact with the time use team for the public sector estimates. But we haven't gone anywhere with that at the moment. But that definitely needs looking at.
Sure.
Good point.
And I guess, David, you're aware of that paper by John Pocus on depreciation of intangibles. I think it would be worth thinking, are there other sources of big data out there that might help? No,
absolutely, Mary. We're very much in a current price space where we're
yes, I'm sure you are.
But, the depreciation absolutely needs to be looked at. And we were, I was part of the ONS side of John's paper when it went through ESCO, so fully aware of that. But we'll take that into consideration when we get beyond current prices.
Yeah.
Thank you very
much. I should also mention that the EU Clem's Intan Invest measures do have something they have for the healthcare sector. Now, of course, it's not the public sector, so it's a bit. Spintan did the public sector, but I think that wasn't the focus in the EU clems is on the industry side. So there's something there, and worth maybe looking again at some of these, or at least when you do your estimates, David, doing some triangulation of what's there for the healthcare sector, for example, in that database to see, do they match up? Are they very close?
I haven't looked at their output for a little while. We are very similar across some assets from the last time I looked. We of course do our own healthcare private sector estimates as well, but yeah, I haven't cross-referenced for a little while now. But yeah, we'll take that away. Thanks, Mary.
No, thank you. And Sarah's been very super helpful behind the scenes and have posted John's paper in the chat if anybody is interested in reading it. I would suggest it's a really good read, really sort of well written and super interesting research. So if you do have time, I would encourage you to have a look at it, because I think we have a captive audience who would be interested in that. Okay, I'm conscious we're down to the last 2 minutes and I don't think we have any questions. So I will just wrap up saying, just to say thank you very much to Mary and Chris for sharing their expertise and thoughts and engaging so well over the last hour. Very much appreciated. The webinars are coming thick and fast this series. Our next one is next Thursday, the 12th of February, and it's on another super interesting topic, compiling national capital accounts in the UK. That's going to be presented by Paul Eakins and Joe Grice. The discussant is Ian Dickey and is going to be chaired by Paul Schreier. So that's 12 o'clock next Thursday. Please have a think about joining us then. And I would finally want to say thank you again. Thanks to the audience for choosing to spend an hour with us. Thanks for engaging so well. Now, this is what the webinar should be like, a bit of an interaction, really nice interaction between the experts and the audience, which I thought that's exactly what it was. And thank you again. And I wish you a very good rest of the day and hopefully see many of you next week. Bye, everyone.